If you've seen any of my videos in the past, you know that I love sports and athletics. So a topic that I want to talk about today is plastic surgery for the fit community. Now that doesn't necessarily just mean those who are bodybuilders, but anybody who likes to be in the gym, who's athletic, and that might not be the people that you might think are the ones that would necessarily be ready for plastic surgery. If you love to be in the gym, you love going to yoga, you love playing sports, working out, you might not think that plastic surgery would be right for you, but I know that some of you have some areas on your body that you might not be totally happy with, and you are wondering if there's something that you can do for yourself. Well, there is, because there's some areas that the gym might not help out, whether that's loose skin, stubborn areas of fat in certain areas, a muscle separation in the midline of your tummy. We can help you out though. Don't be scared to come in and talk to us and see if there's anything that I can do to help you out. I've had people like professional trainers, professional athletes come through the doors here, and we've been able to help them out as well. Now, just because I'm talking about plastic surgery, that doesn't mean that it's a shortcut to achieving your goals. I always encourage continuing to stay fit, stay in the gym, stay healthy with exercise and diet. And that's true both before and after surgery. Even after you have surgery, those things can continue to help improve your results throughout the recovery process and in the long term. So where can we help you out? Well, almost anywhere that you think there might be a problem, there might be something that we can do. But I'm going to talk about some specific areas that are more common, like the chest, the tummy, and 360 contouring, as well as the buttocks. In the chest, this is a common area of problem for both men and for women, however, for different reasons. In women, the most common area that people want is a little bit of volume enhancement with the breast augmentation or implants. And this can be done in women who are in great shape, fantastic shape, have lots of overlying breast tissue, or don't have any overlying breast tissue. And we can talk about where we're going to put the implants as far as under the muscle, over the muscle. We'll figure out what works best for you, for your situation, and for your aesthetic goals. In the majority of women, in my patients, I put the implant under the muscle because I think that we can achieve the look that most people are going for, and I also believe that it supports the implant a lot better and minimizes other risks. But in some women, that might not be the right option, and we can talk about other options like putting the implant on top of the muscle. When choosing an implant, the way to get the best look on a patient is to really optimize the implant size for each individual patient. That means making sure that the width of the implant is not too wide or too narrow for the look that the patient's going for. And once we've figured that out, we then choose a volume and a profile to help really dial in the look to help meet the patient's goals. This is especially true in women who are very athletic, fit, and active and want to make sure that they're able to continue that lifestyle. If you want a little bit of breast enhancement, but you don't think that implants are right for you, one, we can talk about the reasons that you might be concerned about implants. And two, we can talk about other options that might be there for you, like fat transfer to the breast. There are some limitations to both of these procedures. Implants are gonna put a foreign body inside you, but they really allow us to get that nice shape and upper pole fullness. Fat transfer to the breast is another option, but one, you've got to have the right amount of fat in order to inject it in you, and we'll have to liposuction that from somewhere else. And two, it's got a lot of limitations in how much volume we can add. Sometimes we can do multiple stages of fat transfer if you're not getting the volume you want on the first round, but there's still some limits to how much volume you're gonna get and how much shape we can get and that upper pole fullness that you can get with an implant. Fat transfer is a great procedure because it's using your own fat. It's with you for life. Once it's in there, you don't have to worry about it, but it is a little bit more unpredictable. And we put in a certain amount of fat, some of it's gonna go away initially. Your body is gonna reabsorb some of it. But if you're just looking for a very subtle enhancement and a little bit of additional volume, it's something that might be right for you. Other things we can talk about for the female breast are breast lift and breast reduction. Sometimes women's breasts are too large and don't allow them to have the lifestyle that they want because it holds them back and they have to wear multiple sports bras when they're being active and it's just not comfortable. Breast reduction can really address those problems. What we can do is we can decrease the volume of the breast and really fit the breast to the patient's body and lifestyle. A similar procedure is a breast lift or a mastopexy, and this would be for women who don't necessarily want volume reduction, but they do want the breast lifted up. Maybe they've dropped over time or with pregnancy, with weight gain, weight change, and it's just not allowing them to have the lifestyle or the look that they want. So we can do a breast lift to get things lifted up, nice, perky, youthful, and athletic again. We can also combine the breast lift with the breast augmentation to help get things lifted up and restore volume in the breast. And the final thing I'll touch on for the female breast is liposuction to the lateral chest. We can use this when you've got extra fullness at the side or upper outer part of the breast, and we can use the liposuction to really help with the contours in the side of the breast and really get a great look for you. In the male chest, there's a number of different problems that men come to me to address. This can be whether it's fullness or puffiness, or when they're wearing a shirt, they don't like taking their shirt off, they've got too much volume behind the nipple, or where they just want a little bit more definition to their chest because there's just a little bit too much overlying fat there. Let's be honest, no one wants man boobs. The medical term for this is gynecomastia, and there's a number of different things we can do to address this. First, there might be too large of a gland behind the nipple, and that's what can really cause that puffiness. In order to address that, we can make a small little incision on the underside of the areola, hides really well, almost disappears, and then we can cut out that gland to really address that. And then we use liposuction in addition to that to really shape and contour the chest and take care of all that extra fat that's causing that volume excess. And depending on the amount of skin lax that you might have after we remove that volume, we might do things like skin tightening with our BodyTite device to help address the skin. For significant amounts of extra skin, we might have to use a bigger incision along the underside of the chest to really cut out all that extra skin. But most of the time, other than in extreme situations, we can avoid that bigger incision. Like I talked about in females, we can also do liposuction to the side of the chest, and then we could just use the liposuction and skin tightening to really dial in some good contours. And we can do this whether we're addressing some gynecomastia or whether you just have a little bit too much extra fat and you've been hitting the gym hard, you know there's big muscles under there, but you just want to help bring out that definition that's under there. Moving down the body, next we're going to talk about the tummy area. And this is really dependent on what you need and what the needs are to accomplish your goals. And that can be based on how much extra fat you have, how much extra skin you have, whether there's a muscle separation in the midline, whether you need 360 contouring. We're going to talk about all that stuff. Especially for the females out there who have had pregnancies, who have had lots of weight loss, weight gain. The number one thing we're gonna have to determine is if you need a tummy tuck. And that's gonna help us not only take excess skin, but if you have a separation of your muscles in the midline, or what we call a diastasis, that's what we're gonna need to use to fix that. There's a whole number of different variations of tummy tucks. Anything from a full tummy tuck, extended tummy tuck, circumferential tummy tuck. But for some people who don't have a lot of extra skin, for those really fit people, you might be a candidate for something called a mini tummy tuck. It's a specific subset of populations who are actually good candidates for this, and doing that procedure in the wrong patient can actually lead to poor results and bad aesthetics. Regardless of which tummy tuck we decide is the best option for you, it's gonna remove the extra skin from the lower tummy, pull things nice and tight, and allow me to repair that muscle separation in the midline and really get things nice and flat. If you've got a muscle separation problem and we don't address it, I could remove every bit of skin and fat from your tummy and you might still not have a flat tummy when we're all done because that muscle separation causes a little bit of bulge in the tummy. The tummy tuck procedure is definitely a trade-off for a scar, but I keep the scar really low and use different techniques to help get that scar to heal as good as possible. The tummy tuck can be done in both men and women. Women more commonly tend to need that muscle repair in the midline because of things like pregnancy, but men can also benefit from it as well. If you've had lots of weight gain, weight loss, those are things that can also cause those muscles to separate. Even if you don't need that muscle separation repair in the midline, you might have enough excess skin that we still need to cut it out because other procedures we can use, such as BodyTite skin tightening, might not be strong enough to really get you the results that you want. If you do have that muscle separation in the midline, it might be causing weakness to your core because it's not allowing those abdominal muscles to contract in the way that they naturally contract. That might affect your ability to build a strong core in the gym and get as much out of your workouts as you really want. This part of the procedure is not just about how things look, but it's also a functional part of the procedure. Another cool procedure we can do to enhance those ab muscles is fat transfer to the rectus abdominis muscles, or the RAFT procedure. That's where we inject a little bit of fat that we take from somewhere else on your body into the ab muscles when we do a tummy tuck. And that can add a little bit of volume to the muscles, and it also hypertrophies the muscles or makes them bigger on their own over time. Another powerful tool that I like to use for the torso area is liposuction. And this can be whether we do a tummy tuck or whether we're not doing a tummy tuck. What I like to use this for is not necessarily volume removal or bulk volume removal. It's not a fat loss surgery, but I do like to use it to make sure we're maintaining the natural contours of the body, really help us dial in the lines and get the shape that we're going for, and to make sure that we've got a harmonious relationship between the front, the sides, and the back, so that we're not just flattening the front, but when you turn around, everything looks the same as it always did. I want things to really blend together and get you 360 contouring. Then depending on different areas that we do the liposuction on, you might have still some excess skin. We might need to use things like BodyTite, which is a skin tightening laser that we use to help really tighten up the skin in certain areas. What about the people who might not have excess fat all around, or might just have certain stubborn areas of fat that they want to address? Well, that can be helped to address those areas too. And that is a common concern in people who are really in that fit community, or people who are very active. They might just have an area on their lower back that really just, no matter how much they're hitting the gym, how much they're hitting the cardio, it just won't go away. This is a problem that I really like to use the liposuction on and really help address those stubborn areas. A common thing that I get asked is if we can do high def liposuction. And that's something that I do really like to do, but what I don't want to do is just carve some Ninja Turtle looking abs into a tummy that's not ready for it. I like to make sure that the procedure we're doing for you is the right procedure for you, and it's going to look natural, athletic, fit, but not fake and obvious. I like to use the high def liposuction to highlight the muscles that you have under your body. And that might mean in some people there's a lot more definition, in some people it's just highlighting the natural lines so that it looks not surgical and really makes those peaks and valleys come out. With all these procedures, especially with men, they might wonder, but can you do these and continue to make me look masculine and not make me look feminine? In females, we want to really get a nice hourglass contour, but that's not the case in males. And I know that, and we take that into consideration with each procedure we do. We'll get you looking right, and you're gonna love your new look. Now what about that booty? Both men and women come in wanting some enhancement to the butt, but they're for different reasons. In women, they want the butt to have more pop, more of that athletic look, fill out those yoga pants, have a really nice contour and hourglass shape. And we'll use fat transfer to help get you that. We'll use fat that we take from other areas of the body, we'll inject it into the butt to really get you that shape that you're looking for. And we'll talk about all of that and what your goals are before we go into the procedure. In men, they don't necessarily want that hourglass shape, they want the athletic look, but some of them really just have a flat butt and they can't fill out the jeans. The jeans are falling off their butt. So we can just add a little bit of fat in the back to help really get a little bit more pop, a little bit more shape to the butt and keep it really nice and masculine. In addition to just fat transfer to the butt, there's some other things that we have talked about that can also help address the shape of the butt. When we do liposuction to that lower back or an extended tummy tuck around the back, that's gonna help change the contour and the transition from the lower back to the top of the butt and really give you a nice pop even without putting that fat into the butt. That fat's just gonna enhance the volume a little bit more and really allow us to shape things if you need it. So if you're fit, you're hitting the gym all the time, you're going to yoga, you're doing your cardio, but you still have areas that you might need addressed or want addressed, some of these procedures might be what's right for you. Come in, talk to me, we can figure out the best plan to get you to your goals, because your lifestyle, your diet, your exercise is only going to enhance these results and make things better in the long run. I'm Dr. Jeremy Bosworth with North Texas Plastic Surgery. If you think any of these procedures sound good or might be right for you, check out our website below or visit my Instagram page at RealDrBoz. Send me a message, make sure to like, comment, and subscribe below.